Hi guys, it's Dr. Hardy, your pediatric obesity expert. Thank you for tuning in and welcome back to my channel. All right, so today's topic is about screening your child for issues related to obesity. So if this interests you, let's talk about it now. So many times a parent will come to me and ask me, at what point do I screen my child for issues related to their weight? So they know the child is gaining weight, but they're not sure if they should just have the child exercise more, get them into sports, activities, monitor their eating, or are they at the point where they should go in and get a workup, get some blood work, screen for diabetes and things like that. So where do we draw the line, people? So I usually respond to that question with another question. I usually ask, are they at or above the 85th percentile for weight? That's considered overweight. Greater than, at or greater than the 95th percentile for weight is considered obese. So if they fall into that category, if they're 10 years old or already started puberty, then we have crossed the line. You should see a provider and they will ask some screening questions to see if your child is at risk for prediabetes or diabetes and if a workup is warranted. So I'll say that again. If the child is overweight, meaning they're greater than the 85th percentile for weight, and they are either 10 years old or they started puberty, they do need to be seen. And then when you're seen by your provider, they will ask some pre-diabetes and diabetes risk factor questions. And one of those questions is, was the mother of this child a gestational diabetic when pregnant? Meaning, when you were pregnant and you had to drink that sugary drink, were the results abnormal, and did they tell you you were a gestational diabetic? Did they put you on a diet? Did they tell you to watch, your blood sugars and to check them? So if you were a gestational diabetic, your child meets a risk factor. Another risk factor is if there's a family history of type 2 diabetes. And it's almost like the way I see it, almost every family has some, type 2 diabetes in it, but it has to be a first degree relative. So if maybe you weren't a gestational diabetic, but there is a first degree relative that has type 2 diabetes, that's a check mark. Your kid falls into the risk factor list. Another risk factor is race or ethnicity. So if you're African American, Latino, Pacific Islander, Native American Indian, that's a risk factor for having type 2 diabetes. And so they would initiate a workup if you had that. So you may not have had gestational diabetes. Maybe there's no first or second degree relative with diabetes, but you're African American and your kid is at the 85th percentile or above and they're 10 or they're in puberty. You should get a workup. We have crossed the line. Another risk factor is on their physical exam. So if they have signs of insulin resistance on their exam, then that's a risk factor. So things like acanthosis nigricans, fancy word, but that's when they have the dark skin and it looks thickened on the back of their neck and you can't wash it off. If they have like dyslipidemia, which is like a cholesterol issue, or triglyceride issue, if you've heard those words from your doctor that they have had that, then that's a risk factor. All right. What else? Even small for gestational age babies. If your child was a teeny tiny baby, they told you the baby was small. They did extra tests because the baby was small. They monitored the baby's temperature because he or she was small. Then that's a risk factor because those teeny tiny babies end up being babies that have something called metabolic syndrome and have weight issues and insulin resistance issues, believe it or not. So if they, have only that and they're above the 85th percentile and they're 10 or in puberty, that would be considered a risk. I'm trying to think of anything else. Polycystic ovarian disease, high blood pressure. High blood pressure is also one. So they take their blood pressure, they do the exam. If they have high blood pressure, the dark skin on their neck, the polycystic ovaries from the labs, they would probably know that. If they have a cholesterol issues, those are all risk factors. The last risk factor I can think of is medications. There are medications that will make a child start gaining weight like crazy, especially steroids, long term chronic use of steroids. So, not like a 5 day course for an asthma exacerbation, but a longer, or if they have frequent short courses of steroids. So, if they have an asthma attack every month and every month they're on steroids, that's a lot. And antipsychotic medications tend to give you issues. So if you are on antipsychotic medication specifically, you, meaning the child, falls into the risk factor where a workup is needed. So I hope this helped you, and I'm going to continue this discussion in another video. See you soon.